Dr. Priyanka ma'am, today is October 17, known as the World Trauma Day. So, what do you like take on this day?
So, the trauma means any injury, sudden injury or illness which happens, which you are not ready for. So, trauma can be physical, like a roadside accident or sudden burn, or it can be like a sudden shock you get, or it can be something which is more psychological in nature, like sudden loss of parents, or sometimes it can be loss of a pet or something like that, which is hard to get back you to the routine. It shakes you. So whenever suppose you have a fall in the house suddenly, it is also a trauma. So the trauma, because of that, now there will be some amount of days or months it will take you to recuperate or reorganize your lifestyle, because you may not be able to do the same things what you were able to do before that injury or illness. So some trauma can be very severe, like head injury. Like head injury is one of the severe forms of trauma. So road traffic accidents are the major cause of trauma throughout the world. Around it is estimated around 50 lakh people die every year because of trauma, majorly because of road traffic accidents. So that is what trauma is. This year the theme of trauma is basically work site trauma, related to prevention, or we are more modification at the work site. Things like having a clean flooring, not very cluttered environment, or avoiding any chemical spills in the factory, or using safety equipment, more knowledge about that, or having proper signages inside the factory which will help the people who are in the factory or outside where to find what. Also wearing helmets, being very careful about the electrical sockets, chances of electrocution or fire or explosive or chemical reaction, or proper clothing when you're working at the work site. All these things, sometimes even like being attacked by animal, sometimes in the work setting. So all this, most of the industrial places, all the manufacturers and everybody who is working in the industrial sector are very aware about the safety, and they have to follow certain norms. But it is also the duty of the employees who are working, that they have to follow those norms, because if they don't follow, taking it, and I don't want to wear the helmet, I'm feeling hot, then there are very high chances of injury. So mainly safety is a priority for each and everybody, and health is a very very important aspect, because once you get an injury, it will stay. It is very hard sometimes to come back to the original routine or the lifestyle. So it not only causes a trauma to the person because of the injury, also the family members also undergo a lot of psychological trauma, financial expenses, lot of things which revolve. So today's day, the World Trauma Day, is supposed to be creating awareness about how to prevent such incidences, and to be more careful about our own actions, and also the people around us.
Ma'am, aftermath of trauma challenges, what are be like?
So after trauma challenges would be like, we have sometimes patients, what we get, like a hand crush injury, like sometimes sugar cane, like when they crush their hand, like all the tendons and ligaments get injured. And something like machinery, even when they lift up some heavy machinery, if you're not using proper equipments to lift, sometimes that can cause. So what happens is, if there is a very consequence of such injuries are usually lifelong. Sometimes there can be an amputation. So that rehabilitation is a very crucial part. Not only physical, but psychological part is very very important, to get the person back to the earlier stage of his lifestyle, where he is able to be independent. Maybe he's at home, at workplace, because there is, it happens within a few seconds, and you feel that you are not capable, or it will take you much more effort to do the same thing which was like very easy or non-challenging initially. So the rehabilitation will be longer, it will take you longer, but you should not get psychologically distressed. Main thing is it is okay, and you have to keep on moving and working on yourself. Take the proper help from your doctor, your occupational therapist, physiotherapist, psychologist around you. You have to try to find out. You can read about lot of materials. You can read about the role models. You can Google, or figure out, talk to some people who have gone to similar problems. It will help you, and you will come out of it.
And few people require medical assistance but still hesitate to take it. How you look at this situation?
So, like, which very commonly seen, like, there are a lot of road traffic accidents and people don't come forward. So, a lot of initiative to Young Indians or Rotary has been already taken, to get, like, they have this program for even children called Chota Cop, or things like that, which will bring more Masiha and all these programs to encourage people to come forward, understand the rules and regulations of basic driving skills, not to be, when you're tired or somebody is drunk or feeling sleepy, not to drive the vehicle, wear the seat belt. The people are very scared because of a lot of police investigation and all that stuff. But I think as per the law, a person who helps is a masiha, or God's gifted person, like, so it is, you have to not think. I think people think too much at that situation. A help is needed, and you have to go and help the person. That you have to do the right thing, what is to be done, and not be scared. There is nobody who is going to point. Obviously, even the person who has been in the accident knows that you are helping that person. So people have this psychological fear somewhere. But I myself have helped many people in my life when I've seen many roadside accidents. So being a doctor, I have really, gone out, and sometimes it becomes, I've seen people are just like, it happens in a crowd, and just people are just like wait and watch till somebody comes to help. So maybe you can, if you have a friend with you, please take that friend along if you feel scared to help somebody alone. But yes, I think we should go forward and help everybody who requires. It's a part of humanity or mankind.
Ma'am, one more question for you. The students who are taking higher studies in medical line, what would be your advice for them
Regarding,
regarding higher studies they are pursuing medical line?
yeah, my advice for them is like, you have enrolled in that educational field because you love it, you want to help others, you want to bring the change in the society, you want to bring the change in the medical research. So sometimes, like, since we're talking about trauma, there is lot of psychological stress, long hours of duties which doctors have to undergo, like, in all the fields, from MBBS, dentistry, occupational therapy, physiotherapy. So all of them undergo lot of stress. So I feel it's, you have to think down the line, what is the results. Don't look at that particular day. The end goal is going to be very good. You are going to make a big difference. You are, whatever you're working towards, the people is, they are going to give you a lot of blessings, lot of, you will have a name for yourself, and that name carries a lot of weight. We are somebody who are trained through our seniors, and we have to understand that the doctors who are training us also have reached to that position because through the hard work. So let giving, some people become anxious, some people become depressed, and these things have to be overcome. Sometimes as a doctor we also might need little help, and it is okay, because I feel most of the doctors don't care about their own health because they're so much continuously working for others. They don't give any importance to self-help. So a lot of things like yoga, meditation, even like any dance class or creative painting, anything like that, I think you should try to spend few hours in at least a month, if not a week or a daily basis, to channelize your mind, to think outside your routines, is very very crucial, and I wish all the best to all the medical students who are studying. And be calm, be calm, things are going to be all right. I feel that's very important. There's a lot of anxiety with viva.
Ma'am, your full name and designation, and how was your journey been in medical line?
I am Dr. Priyanka Raikar. I am a pediatric occupational therapist. I am from studied from occupational therapy from KEM Hospital, St. GS Medical College, and I have done masters from University of Southern California in Los Angeles, and I was practicing in Every Child Achieves in Hollywood for 5 years. My coming back to Goa, and my journey has been working with children from premature infants to 18 years with all different kinds of developmental delays and disabilities has been wonderful. I have a multidisciplinary staff with physiotherapy, speech therapy, psychologists, special educators, uh, child nutritionists, occupational therapists. So we work with different types of disabilities. The journey has been very challenging in certain ways because mine was the first clinic, multidisciplinary clinic in Goa working for disability. And now I think there is a lot of improvement. I've been practicing in Goa for last 13 to 14 years now, and there has been huge improvement over not only in the mentality of the parents, but also the schooling system, the government support. Everybody has been channelized. All the organizations like Rotary, YI, and many different organizations are thinking very consciously. The Purple Fest, everything has really expanded. There is DRAG, Disability Rights Association for Goa. There are parental groups. Swimming coaching is happening. A lot of things are happening in Goa. It's a wonderful state, and I'm very happy with the progress the Goa government is supporting for all the different ventures for all the class of people in Goa.
Thank you, ma'am.
Thank you so much.